fantastic. All right, hello class. We're gonna jump into chapter 20, patient environment and safety. We're gonna go around the room and I want you to tell me what that means to you. It could be anything. We're gonna start with Jennifer. Patient environment and safety. It's totally fine if you look inside your book and shout something out from your textbook. Okay, that's a good one. That's an important one. So what Jennifer said was making sure your patients are safe. There's no sharp objects around. That's a good one. All right, Miss Daphne. No spills on the floor. That's important. Okay, yes. So those non-skid footwear. Okay, very good. Shanika. Yes. So throw rugs, no, right? Never choose throw rugs. Yes, that's super important. Okay, very good. So she said non-skid rugs and make sure when they get in and out of the shower or the bath that they don't slip. Okay, so that would be maybe handrails, side rails. Maybe they will have one of those shower mats right inside of the shower, bath mats, but actually one that doesn't move, right? The one that has like a non-skid suction that sticks to the floor. Okay, Dominique.
I was gonna say the shower mat.
Oh, sorry. Oh, shower mat. Okay, very good. And my twins.
Patient safety to me is make sure you have their phone light, just in case something happens. Little ones is make sure they have on the right socks.
Okay, so those are great things. Okay, Tia.
For me, it's a lot. Basically, though, like the environment, make sure their room temperatures are right. A big one in my new job is putting things while in the bathroom. They ask us a lot, patients. Oh, so and so bring my oxygen tank inside the shower. No, I'm not putting up the oxygen tank in the shower. So that's a big one because a lot of aides will take things and plug it in the bathroom while they're in the shower. So like electricity is big, major for me, temperature wise, call light, and that big going low.
Okay, yes, excellent thing. So she said electrical safety. Okay, plugging in things while they're in the bathroom or the shower. Call light within reach, bed at lowest level. Okay, so great things. Okay, very good. Quay.
What they said, and also like medication.
I like how you think. Tell me.
Like we have to make sure that we're giving the patient the right medication and not giving them the wrong, and just making sure that it's that patient that is supposed to be receiving that medication, because you know, give somebody the wrong medicine and then cause them to have more illness or potentially ill.
Right? Yes, very good, Clay. So I might have mentioned this to you all already, but there was a nurse and she's greatly studied. She was a NICU nurse and she did not do her dosage calculation properly. And so NICU is a neonatal ICU intensive care unit. So this baby was a very sick baby. And she realized right after she gave that medication, she was like, oh man, I gave the wrong dose and it was too much. And so eventually that baby ended up dying. Now we don't know if the baby was going to die anyway because it was in the NICU, it had some heart issues. But this nurse ended up administering the wrong medication, the wrong dosage. And so she immediately reported it, right, which we should do. And of course, the next thing that we do is assess the patient. And unfortunately, she ended up committing suicide. Days later.
The patient?
The nurse.
The nurse.
The
Oh
nurse.
my the patient was a lady.
The patient was the baby died. So this nurse.
I didn't hear, all I heard was suicide.
Yes,
Felt
so
so bad.
the nurse committed suicide because of this, dosage calculation error that she made. And it probably contributed to the baby's death, but we don't necessarily know, but the baby was already sick. Yeah, so it was tough, and she was a NICU nurse for, I think, maybe 20 years, so she wasn't a new nurse. She loves what she's doing, so she had so much guilt and so much, anguish that she ended up committing suicide. And I share that with you because we're talking about patient safety, we're doing dosage calculations, and it's a little rough, right? But it's really, really important, so that's why I want to take time to go over it with you. Because it is super duper important, no matter what field or area of nursing you're working in, dosage calculation is always important, especially with the pediatric population. Okay, so that's a great thing that you said, Quay, about the medication. Make sure that it's the right patient. Sometimes you can have patients with the same name. One time I was doing a mother-baby clinical, and we had two patients. Say the name was Mary Smith. We had two Mary Smiths, okay, that had given birth. I mean, what's the odds of that? And they both gave birth to a baby boy, right? So that was like, oh my gosh, like I have to be careful. And so one of the things would be is, okay, one nurse would have Mary Smith, A, and then the other nurse would have the other Mary Smith. So you shouldn't have two patients with the same name like that, or names that are close together, because that could be a cause for medication error. All right, Candy.
Just making sure the patient is safe and good for the doctor. And that about the medication, educated, so they're going to be administering for themselves.
Okay, yes. So sounds like you're saying I better make sure I get a return demonstration from my patient. So if I teach my patient Smith how to administer insulin, the next time it's time for insulin, I want to see her do it, right? Because when she's discharged from the hospital, she's going to be doing it on her own, because I'm not going home with Mrs. Smith, right? So that's right. Okay, excellent. All right, Christina, tell us something. Patient safety, environment safety.
Neatness at all time. When patient is getting out of the bed, making the bed back nice and neat, and preventative of wrinkles in the bed.
Okay, excellent. So she said neatness at all times. If the patient is getting out of the bed, like if they're going to take their bath, they go to physical therapy, that's a great time to strip that bed and give them fresh sheets free of wrinkles. Why should we get a bed free of wrinkles?
Pressure ulcers.
Pressure ulcers, friction, shearing, right? That can actually damage their frail skin. Okay, excellent. Okay, Mercedes, safety. Mercedes. Okay, let me get the chat open. I didn't have it open. Okay, so we'll come back to Mercedes. Okay, Kiara. Okay, Melissa.
Hello?
Hello, yes. Okay, we didn't hear you. So yes, patient safety, environment safety.
Did someone say like making sure the cords are out of the way? So if they're hooked up to any monitors or have anything like if they have any cords near their bed, making sure it's not on the floor where they would get in and out of bed.
Okay, so trip hazards. So cords, IV tubing, if they have a chest tube, Foley catheter, any tubing, yes, those are all trip hazards. Very good. And nobody said that one. Okay, very good. Okay, Melissa.
Making sure that they have their call bell within reach and their personal belongings.
Okay, call bell within reach and personal belongings to include cell phone, hearing aid, glasses. Those are all important. Okay, good. Thank you, Melissa. And then Raven.
Well, Melissa took mine. It was going to be for, of course, the call bell. Of course, with making sure that their bed is wrinkle free from prevention for pressure ulcers. also making sure that the residence room is clean. Making sure that personal items are close by for, of course, for reach for them, so it prevent them from having any type of fall risk. So I think that's pretty much about it. Cleaning up any spills or anything like that.
Okay, well said. Okay, excellent. Okay, so we are preparing a safe environment, but it sounds like you all know how to do that, so that's pretty good. So what are the nursing responsibilities, okay? And noises in healthcare facilities, and how could that affect patients? How many of you have ever had family in the hospital, or you've been in the hospital and you're like, I can't wait to go home so I could sleep? Because every 4 hours in the hospital setting, we got to check our patient's vital signs. During the day, every hour we round. During the nighttime, every 2 hours we round to make sure that the patients are alive, right? So that can be distracting for a patient, and neatness is going to be important for all the reasons you mentioned. But also, if something is neat and clean, it reduces the risk for infection in your patient, right? All right. Excuse me, in clinical, you're going to discuss how it can affect your patient using the correct technique to make an unoccupied and occupied bed. And I'm going to tell you, if the patient's getting up, even if it's to sit in a chair, take that time to make their bed. It's much easier to make that unoccupied bed, okay? So, factors affecting the environment. Well, you all talked about this, right? So, Tia even mentioned the temperature. Now, I will tell you, your geriatric patients, they're usually super cold. So you go in their rooms and it's so hot. And those are the ones that usually are on contact precautions. So it's like 100 degrees in the room. You got to gown up, right? Put on your mask and everything. And then your nose itches, right? So, but temperature is going to be a safety situation, right? Ventilation and humidity, the lighting, odor control. If you have a patient that has had a bout of incontinence, when you're cleaning the patient up, take those dirty linens, take the trash, and just change it at the same time. I never leave that. And it's like, well, it doesn't matter if I'm a registered nurse, I am the patient's nurse. I'm not going to leave smelly, stool, right, in a bag that the patient can smell and the family can smell. And a lot of times we have that spray that we can spray to kind of, freshen it up a little bit, because that's not helpful for the patient. Okay. So as a nurse, don't be the one to say, oh, that's not within my, job description. Everything is within your job description. I had a
told a girl today.
yes.
She wanted to go here for RN. She was like, that's why I can't do y'all job. I just want to go for nursing. I said, well, nursing is still the same.
I get so offended.
Like, what do you mean? Well, I just won't never have to change the brief. Why won't you have to change the brief?
In the hospital setting, all you doing?
That's what you do. So as the nurse, a registered nurse, an advanced practice nurse, I have a master's degree. That's okay. I can still empty a trash can. I can still change a brief. I can still clean up incontinence. I remember I was a new nurse, and the patient said to me, and she was just having a bad day, I guess. And she said, how many years did you go to school? What degree do you have? And I said, okay, I have a bachelor's degree. She said, you went to school for 4 years so you could learn how to wipe my butt. And I laughed and I said, you know what, you're right. And I'm like, I hope I do a good job, right? But that's what nurses do. That is a part of our job. It's not the only thing that we do, but it is a part of it. So if you think that you're going to be a nurse and you're not going to wipe butts of your patients, that is the wrong attitude. So that young lady has a really bad attitude.
Oh, when she come here, she'll give it together.
Yeah, so she will really hopefully get it together. But some think that they're above that, because I've worked with nurses that have told the care partners, you need to go do this, get so-and-so on the bedpan. I can't do that because I'm passing meds. And I'm like, if the patient is in need, then you can help them. Now, I understand sometimes it's short staff, like in a hospital setting, like the registered nurse might have 6 to 8 patients. But also that, that CNA or their care partner now has, 12 or 18 patients. So we really have to work as a team, okay? So noise is something that's a safety issue. If it's noisy, if the patient is a neurovascular patient that needs, low stimuli, don't put them by the nurse's station, okay? Because that's something that can affect them. And so what I mean, a neurovascular patient, if the patient is at risk for seizures, they need to have low lights, low noise, So they shouldn't be by the nurse's station because the nurse's station is busy, right? There's a lot of talking. Sometimes there's laughter. That's not going to be helpful for that patient. Interior design. We don't want, all kinds of, designs. If it's too busy, that could be distracting for the patient. Something also that could be distracting for the patient, if the overhead is like this, right? If your patient is like going through detox or withdrawals, they can see this and, oh my gosh, look at all those bugs in the ceiling, right? So we want to be careful about how we design the hospital setting, okay? If you go to CHKD, it's really children friendly. Like there's, bright colors, there's paintings of, animals, like there's the fish tank that's on the floor, that kind of thing. So that's really thought out. In the mental health unit, it is bare, okay? We really don't have a lot of paintings or anything like that because that could adversely affect our patients. In the Gero psych unit, they sometimes have like those busy vests that they can have so they have something to do, but the design is intentional. Something else, when you do mental health clinical, you will see that everything is kind of like bare bones. So the under the sink, the piping is covered, like nothing is open. There's not going to be anything that the patient can use to hang themselves or to harm themselves. Okay, it's pretty bare. And even in a mental health setting, the patients are not wearing hospital gowns. They're actually wearing scrubs, very plain scrubs. Okay, and they're not wearing civilian clothes. Okay, so neatness and privacy. Privacy is, drawing that curtain, but also closing the door. Also, if somebody is in the room, is it okay, Mrs. Smith, if we discuss your condition in front of your loved one? Okay, is it okay if we perform this procedure or if I do your assessment or draw your blood in front of your loved one? That's going to be important to understand. So these are all things. All right, so temperature. Infants and older adults require warmer rooms, right? And we know with infants, we're always concerned about their temperature regulation because they are not able to thermoregulate. Older adults have a loss of collagen, elastin, subcutaneous layer, so they're going to be cold. And I think Tia told us the story about our patient that was really cold and they just kept piling on the blankets and they ended up getting pressure ulcers and then amputation or they died, right? So we really have to balance that. Now, everybody that's cold really likes those warm bath blankets right out of the warmer. Those feel so good, right? And I would submit that if you have a patient that is cold, that's one of the things that you could possibly do. And please don't be the nurse that takes the last blanket out and then doesn't put some more in so they can be warmed up, because that's not good. Okay, the next nurse.
So they used to do that to you with
Yes, it's just like drinking the last of the Kool-Aid, or you leave like
a
this
pig.
much. It's like, oh well, I didn't have to wash the container because I didn't drink the last one. Like, come on, people, fill things up, leave things, better for the next nurse. All right, operating rooms are critical care areas are slightly cooler. Why is that? Yes, the OR room is freezing. It's just like when you're on the Navy ships, they keep it freezing to keep the bacteria from reproducing. Ventilation, fresh air. Now, we're not going to open windows in the hospital, and I haven't really seen any hospitals where you can actually open the windows because it's usually like a big glass pane. But just in case it's an older facility, we don't open windows. We don't use fans because we're blowing, air around. I will tell you one time we did use a fan though because we had a power outage. And so what we did was and it was the summertime, so we got big chests of ice and then they got the fan and that was blowing cool air to your patients, especially your patients that are at greater risk of dehydration. So yes, ventilation, we don't use fans, but under certain circumstances, that's a possibility. Ventilation. An important thing is your tuberculosis patient. They are going to be in a negative pressurized room. What does that mean? Their air is not going to mix with the rest of the facility. Their air is going to be going outside the building, okay? Because we know that tuberculosis can live in the air for hours, right? So, and if that patient that has tuberculosis has to come out of their room, they must wear a mask, okay? They must wear a mask. And if we're caring for that patient with tuberculosis, we're wearing the N95. Okay, so humidity from 30 to 50 is comfortable. Too little humidity will dry the respiratory passages. So that's why if you have a patient that is on continuous oxygen via nasal cannula, you may see the container of sterile water, sterile saline, humidifying that oxygen so they don't dry out their nares. Because what happens if the nares dry out? They can get nosebleeds, yes, and it can crack, right? Once we have a break in the skin, that's an opportunity for infection to go right in, right? So very good. All right, lighting should be adequate. I remember when I was a new nurse, I tried not to wake up my patients, so I was trying to do things in the dark. That is not a good idea, right? You're gonna end up hurting yourself. Just explain to the patient, I'm sorry, but I have to turn the light on so I can see what I'm doing. Because you want to keep them safe and keep yourself safe. Okay. So the patient should be able to control the lights and always ask the patient, do you want this light on or off? That's going to be important, especially if they're trying to sleep. Okay. Odor, empty and rinse bedpans, bedside commodes, and urinals. Please don't leave those waste because they smell, especially if the patient has an infection. Any dressing, just dispose of it. Keep everything as clean as possible. Old flowers, stagnant water. And so you all know, y'all should not be coming smelling like Victoria's Secrets to care for your patients. You should not be. Some of these students that came in here tonight, and I did not kick them out, but they came in here like Beyonce. They had hair down to their waist and those false eyelashes and nails. That is unacceptable. You cannot care for a patient like that, okay? You cannot, okay? So if you come in smelling all sweet like Bath and Body Works, Victoria's Secrets, your patient has asthma, now you're gonna send them into an acute exacerbation. You come in smelling like vape or whatever, right? Yes. Yes, and that includes smoking and vaping, right? That's the worst thing that you could do. Come in, from smoking and everything, and then work with your patient. And you may think, okay, they can't smell it because I was outside or I wore a coat. But no, if someone doesn't smoke, they're very sensitive to that. If someone has respiratory issues, they can smell that, okay? And you can be sent home from clinical if you come in smelling like whatever. That's not good, okay? And again, your makeup should be conservative. This is not the time to practice smoky eyes and all that other stuff. Like, okay, leave that for when you're not taking care of your patients, okay? Yes, like okay, come on, it's too much. So noise, it's true. Y'all seen some nurses, and it's like, okay, are you like with RuPaul?
Color
What,
hair and all.
what is going on? Like that's fine if that's what you do. Yeah, I love RuPaul too.
Then
That
they be
makeup
offended
is.
when the patients be like, "Are you going to a show or you into
You look like a
acting?"
clown.
They say stuff like that too.
So show you look yes, but that's fine if that's what you're into, but that's not the time and the place. And so I've had people say, "Oh well, I don't look good today." I said, "You know what? If your patient is coding, they're not going to ask you about your whatever. They're going to say probably not going to say anything, but they're going to want to know, can you save their life? That's it. It doesn't matter the color of your skin. Well, sometimes it might." But it doesn't matter the color of your skin or, if you've got dreadlocks or if you're bald headed. Can you be a good nurse to me? That's what's important, okay? So noise, okay? So again, especially your patients that have neurological issues, patients that need low environmental stimuli, we don't want a lot of noise. So if your patient's supposed to have low environmental stimuli, that could mean like soft, quiet classical music if the patient allows it, if they can tolerate it, but not, heavy metal, no, blasting music, and even if it's classical music, don't play it loud, have it very low, right? So long conversations, we don't want to have it, jokes and laughter, no, just not at the nursing station, okay? That's why we have a staff room where we can go in, the door is closed. And I'm not saying don't have fun, but if you have excessive chatting and laughter, especially at night, that's not helpful to the patients, okay? answering alarms and IV pumps promptly. That's important. Now, sometimes we do get that, you block things out. Like if your child says, mom, 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 mommy, mom, 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 like 50 times, like, okay, I'm not hearing it anymore. And the same could happen for like the IVs and, the call bells. Don't do that because the patient is pushing it because they need something. Okay. Even if they're pushing it every 5 minutes, we have to figure out what's going on. All right, so we talked about the interior design. So patient room public areas look like more like a hotel because we want it to be invited, right? Rooms have draperies and colorful bedspreads, and we want the patient to feel at home because guess what? While they're there, that is their home. Y'all talked about neatness, removing trays, okay? That's going to be really important. Okay, removing those trays. Nobody wants their half-eaten food to be left there. So please remove it promptly. Clear the over-the-bed table of any clutter. That's going to be important. Yes, and arrange it the way the patient wants it to be so that they can reach it, right? And it's arranged that's neat for them, okay? All right, and please don't throw away things if the patient does not give you permission. I'm guilty of that. I was like, okay, everything is gonna be clean. This is old. Oh man, that lady got some. She's like, I need these tissues. I reuse them, and I'm like, okay, well, let me put it back. Right. So always ask the patient before you throw something away. Okay. Knock gently. Yeah, don't just bust into the room. Knock gently and introduce yourself. Hello, my name is Colleen. I'm your nurse tonight, right? And so in some places like Lake Taylor, there's, multiple patients into a room. So make sure you're pulling the drapes, that kind of thing. And so just maintain their privacy. That's important. All right, beds. Beds. We always want to make sure the wheels are locked on the beds. Make sure that the beds have clean and fresh linens. That's going to be important. Both side rails and the top should be up. All 4 side rails up is actually a restraint, and we cannot do that without a doctor's order. We do have specialized beds and specialized mattresses that we can use. We have specialized pillows. So understand, I've even seen like sand beds. There's beds that have the mattresses that inflate and deflate. So we want to make sure that we are using the appropriate bed that will help our patient for whatever condition that they have. If the patient has incontinence and you have to change their bed, right? Remove the sheets, but also wipe down the mattress because that mattress gets soiled as well. Okay, that's important. When the unoccupied bed, again, that's the best way to do it. If the patient is getting up to go to the bathroom, that's a great time for you to change their bed. Okay, if they're going to physical therapy, if they're sitting in the chair looking out the window, that's going to be it. The occupied bed is only if the patient cannot get out of bed, okay? Because it's more challenging, okay? And I would submit to you to make sure you have everything that you need, especially if it's the occupied bed, because there's nothing worse than the patient holding on to the side really like, oh man, I don't have a draw sheet, right? So make sure that you have everything that you need. All right, you all already told me that the bed should be neat, free, orderly, free of wrinkles, okay? So here's question number 1. Florence Nightingale describes 6 elements of environment: temperature, ventilation, humidity, lighting, odor, and noise. Is that the correct answer? Or temperature, ventilation, safety, lighting, odor, and noise? Temperature, circulation, vaporizers, lighting, sensory, perception, odor, privacy. Temperature, ventilation, neatness, lighting, privacy, and safety. It is no, it's actually 2 separate things. And so that's going to be in the beginning of the chapter. It tells you temperature, ventilation, humidity, lighting, odor control, noise control. Okay, those are the things. Temperature, ventilation. So it is 1. It is 1. Okay, all right. Okay, which of the following is not an appropriate guideline for bed making? Check to make sure the bed wheels are locked. An occupied bed is made only when the patient cannot be out of bed. Unfold linens onto the bed. Place soil linens on the floor.
Place soil linens on the floor would be incorrect.
Yes, that is correct. We never place soy linens on the floor. I know you probably seen that done, but that's the wrong answer. Here's the reason why. The patient has a bout of incontinence. They in their stool. They have MRSA in their stool. I put the linens on the floor. Okay, and then what's now on the floor? MRSA. I'm walking on the floor. I walk into my house with these same shoes. I go to my daughter's nursery, right? She's in a toddler crawling on the floor. Now there's MRSA all over my daughter's nursery floor, right? And so just a quick plug, please don't walk around your house in shoes, especially your nursing shoes, because these things live on the floor. You'll bring them into your house, okay? So a lot of nurses will kind of have a decontamination station. Some nurses will change their shoes before they even get into their car. When I was a bedside nurse, I would come in, I would strip down at my front door. My laundry room is right there. I would start to load up and streak upstairs. And so my daughter would be like, oh, okay, hi, mom. Okay, I'll come and talk to you after I, take my shower, right? Yeah. So,
Like, why did they give you a hug? No.
yes, yeah. For sure. So that's really important. But please don't place soy linens on the floor, okay? I know you might have seen that, but that is not appropriate. And if you have an inspection with JACO, DMV, or whoever the inspecting body is, that's a major violation. Okay, so maybe you missed this question because you missed that it was a negative question. So if that is the case, when you're doing your questions, make sure you're asking yourself, is this a positive or negative question? Is this something the nurse should do or should not do? So yes, the nurse should make sure the bed wheels are locked. Yes, only make an occupied bed if the patient absolutely can't get out of bed. Yes, unfold the linens onto the bed. Please do not shake linens. Don't do it. Okay, clean or dirty, because now you're shaking and you're getting that dust and whatever it is into your face, into your eyes, into your nose, into your mouth. Please never shake linens. Okay. All right, so let's talk about prevention, containment, and protection. So how do we prevent mechanical and thermal accidents and injury? Okay, in healthcare facilities and home, we're going to talk about bioterrorism, and we're thinking about different kinds of agents. How do we use protective devices, and what is the legal implication of protective devices? And protective devices are restraints. Okay, somebody pat Miss Daphne. There's strengths. All right. In clinical, okay, we're going to understand how to clean up biohazards. A lot of times we have to notify environmental control, right? Or environmental services, rather. In Centera, they usually wear black, right? And please do not disrespect environmental services. They are really, really important, because if they don't do a good job, then you will be bringing infection home to your family. Okay, so environmental services, they're super important. I know some people are, whatever they are, but everybody's a part of the team. Everybody is valuable. Everyone should be respected, because we're all working to care for the team, for our patients. Okay, discuss your clinical facilities response plan to a bioterrorism threat. Once you get orientation to your clinical sites, you're going to learn about the different codes. So there's code blue, code red, code silver, code black, I think, is a bioterrorism. But you're going to learn all the different codes, and that's what they will say, depending on whatever the threat is. Code silver is kind of like in Centera, it's like a family member or somebody getting physically violent or aggressive. And so it's important to know what kind of code it is, because the right people have to come and report to the area. Given an emergency scenario, practice triaging victims. So we'll talk about how to triage victims using the tags, black tags, red tags, green tags, yellow tags. Are you all familiar with that at all? No, it's okay. We'll talk about it. All right, and then correctly apply an extremity immobilizer. Okay, so we're talking about a restraint. Yes. Yes.
I wrote down the flashcard. They said rules governing restraints not allowed on some.
Ooh, I ripped it up.
So restraints are not allowed in long-term care.
Yeah, I wrote this flashcard when we did the exam review on Zoom. When I went back and read it, I'm like, did I hear it wrong?
So I don't. No, I don't think that's right. It's like, it's not that it's not allowed, but you need a doctor's order
Oh, okay,
for
I'm
a
looking at it.
restraint.
I'm like, no, I'm not.
Yeah,
Yes.
I
I think that
I
one-
remember her saying.
Yeah, she
you
said
need a
something
doctor.
is not allowed, but it probably was, it's not allowed, it's not doctor's order.
Yes, so you must have a doctor's order for restraint, also known as a protective device, and it is only good for 24 hours. That protective device, that restraint, okay? And we use it as long as the patient's behavior warrants it. So if Mrs. Smith is pulling out her NG tube or pulling out her IV or her Foley catheter, and we try to reorient her and she's still doing it, then okay, she may need mittens. We're not going to automatically put her in a seclusion room because she's exhibiting that behavior. So we start with the least aggressive and then work our way up. Now, if Mrs. Smith, anesthesia wore off, she's no longer confused because she had an infection, but they started her antibiotics. She's like, oh, okay, I understand. I'm not supposed to be pulling this out. I will stop doing it. Now, we will contact the healthcare provider to discontinue the use of this restraint because she no longer needs it. She's no longer exhibiting those behaviors. Okay. So then we would remove the restraint after there's a discontinuation order. If the patient has a restraint, every 2 hours we must take off the restraint and inspect the skin, look out for any damage, skin breakdown, inspect the pulse, to see if there's any paralysis, any numbness or tingling, because we want to make sure that they have adequate circulation. And the restraints must be tied on a part of the bed that does not move, okay? So safety is going to be what NCLEX tests you on. Am I going to be a safe nurse? Okay, safety is needed to prevent accidents and injuries to our patients, visitors, and all the members of the staff. So when we think about safety, we have to think about falls, burns, cuts, bruises, fights with others, loss of possessions. Please don't wrap up, Miss Daphne, please don't wrap up the dentures, hearing aids, don't wrap up anything in tissue because that could actually be thrown away. Electrical shock, and Quintia mentioned that earlier, okay? So look at box 20-3 for ways to promote patient safety. And that's going to be on page 336. Okay, it tells you about in a healthcare facility and at home. That's definitely worth reading. Okay, on page 336, box 20.3. Okay. All right, falls. You don't want your patient to fall. Okay, so that's why we use the gait belts if they are getting up to ambulate. 3 common fall factors: impaired physical mobility, generalized weakness, maybe left-sided weakness, altered mental status, maybe the patient is confused. If the patient has sensory deficits, they have visual issues, they have hearing issues, those are going to be important. But y'all, that's kind of distracting if people are trying to listen. Okay, patients at risk for falls may need a leg or bed alarm. So if they're getting up, right, jumping out of bed, jumping out of their chair, they need an alarm. Okay, so this alarm will sense their change in position and go off and let the healthcare providers know, hey, Mrs. Smith is jumping out of bed. Okay, burns. So we want to be careful. Burns can happen from food if they have hot coffee or hot tea. They can also, please don't let the families bring in electric blankets. That's never in the NCLEX world. In real life, never give your patients electric blankets. Always check to make sure that your patient's food is not too hot. Look out for frayed electrical cords. Anything that is not safe when it comes to this, we've got to be looking out for it, okay? Sleeping with cold packs, that's dangerous too because it can end up with frostbite. And then depending on the condition of the patient, they can end up getting an amputation, right? Smoking, everywhere is non-smoking, okay? But you know, some people are going to the parking lot and they're smoking in their cars, but you all won't do that because you know you don't want to come into the healthcare setting or clinical experience smelling like smoke, okay? Educating our patients not to smoke with an oxygen tank. Wow. I've seen people and I'm just like, man, you're gonna blow yourself up because oxygen is what is flammable. It's highly flammable. So we really have to educate our patients about that. Fire, we have talked about pass and we have talked about race. We have to know the location. That's part of your orientation, right? What do we do in case of a fire? We're going to shut the doors. Where are the fire extinguishers located? Right? How do we help the patients? What are their escape routes? Those are all things that we have to do. And so here we have race, rescue, activate, contain, and then extinguish. We extinguish by pass. Pull the pin, um, what is it? Aim, squeeze, and then sweep. Okay. All right. So how do we promote safety? Well, we orient the patient and their family. Welcome to the unit. Well, we assess the patient. That is something that the RN will have to do. The initial assessment is done by the RN, the registered nurse. Okay. We will evaluate the patient's drug regimen. That is your medication reconciliation. That must be done whenever a patient is new to your unit, new, to your facility. Medication reconciliation, because there could be some contraindications, there could be some adverse effects. So we have to know what medications the patient is taking. Never leave medications at the bedside. If they have their home meds, we take hold of those and keep them in the medication room, because we don't want the patient taking medications on the side and then we're giving them medication, right? And toilet the patient on a regular schedule, that is every 2 hours. Okay, all of these things you all already mentioned. Locking the wheels, a light, keep it well lit when they have to go to the bathroom. Non-skid footwear, answer the call lights, tell the patient when you're going to be back, and make sure you go back. If you can't go back, send someone and say, okay, your nurse is with another patient, but they'll be with you as soon as they can. And then encourage the use of grab bars, okay?
You never give them a time, right?
You can give them a time, or you can say, I'm going to try to come back at 3 o'clock, or I'm going to try to come back in 20 minutes. But just let them know that that's in a roundabout time. You don't want to give them it and say, I will be here on the dot, because then they're going to lose faith in you, okay? And something can happen where you get stuck in another patient's room a little bit longer. But if that's the case, like if you feel like you're going to be delayed, you can just tell, okay, ask the charge nurse, can you tell Mrs. Smith I'm going to be right with her as soon as I wrap up, because I told her I was going to come back. So, and that's okay to do. And that helps let the patient know, well, she didn't forget about me. She's just with another patient, okay? So high-risk patients will be in a room close to the nurse's station. High risk meaning that they're jumping out of bed or that they're really, really sick and they need to be monitored very carefully. Okay, confused patients, right? We want to stay with them. Okay, sometimes we can put confused patients or patients that are at risk. They can be in a chair next to us at the nursing station. Sometimes it's okay to do that. Especially if it's like overnight. We've had a lot of patients, because I used to work night shift, that would just sit with us and we would talk with them while we're doing our charting, and there's always somebody there to kind of keep an eye on them. Provide diversionary activities for confused patients. So here's an example. We had a patient that was Alzheimer's patient. They had dementia, and he used to be a mailman in his past life. So what they ended up doing is they gave him a bag and magazines, and he would go and walk around and he would put the magazines down on the different tables. And that kept him from wandering into other patients' rooms, because he was like, I'm delivering the mail, because he was a mailman for like 20 or 30 years. Okay. And then make sure that the brakes are locked on the wheelchair. That's going to be important, or the chair. So non-skid bath mat, you all said that. Night lights, grab bars, buzzers or bed alarms. Maintain the same furniture arrangement, because if the patient gets used to that, right, they have muscle memory. That's going to prevent them from falling. Extension cords, they said that online already. I think Kiara said that. And toys and animals. Okay, I don't know about you all, but at home I have a cat, and there's things everywhere, and I'm like, this is a fall risk. Come on, guys, let's get this stuff up. Okay, provide appropriate community resources, and that could be through a social worker, right? We have our social worker that's a part of the team. All right, biohazards. So biological agents, okay, so I'm thinking anthrax, I'm thinking, nerve agents. A lot of times you'll see questions that, okay, there is a biological threat outside. Okay, if the biological threat is outside of the facility, I'm not going to evacuate the patients. We're safe inside. I'm going to shut the windows, right? Windows shouldn't be open anyway. I'm going to shut off the ventilation and I'm going to put wet towels under the door so that air can't come in. If we are safe where we are, I'm not going to evacuate. However, if there is a biohazard in the building, we're going to evacuate our patients. We have to think about, what if a patient is on oxygen? What if they require supportive equipment? How are we going to evacuate those patients? Okay. So cleaning up spills, depending on what the spills are, there's a certain way to clean it up. So if it's chemotherapy, we just can't use paper towels, right? There's certain ways to clean it up. That way is dictated by, they're no longer called material safety data sheets. They're called SDS, safety data sheets. But it's good to know MSDS and SDS. They're the same thing, okay? So MSDS is the same as SDS, but it was formerly known as MSDS. So here's an example. If you get some chemicals in your eyes, the MSDS or the SDS sheet will tell you, well, wash your eye at the eye wash station for 15 minutes. Apply cold compress, then go to the emergency room. Like, it will give you step by step on what you need to do. Now, not everything you're going to apply cold compress. It just depends on what it is. But this SDS sheet will tell you what you need to do. Okay, any questions so far? So make sure if you ever get a biohazard kind of question that you realize, where is the threat? Is it inside the facility or outside the facility? If it's outside the facility, we're in here, we're safe, we're going to shut down and hunker down, and we're not going to go outside until we receive the all clear. If the threat is inside, we're going to evacuate our patients, and we have to determine those that are on support, like oxygen, like a ventilator. How are we going to safely evacuate them? Okay, so that's your bioterrorism. So pathogenic organisms, again, like the anthrax. Chemical terrorism, that's like your cyanide, your nerve agents, incapacitating agents. Radioactive substances like dirty bombs. Okay, again, we want to notify the appropriate authorities and keep our patients safe. You can't just run out and leave your patients. Once you assume care of your patient, you are responsible. Okay, you are responsible for their safety. So here's some common diseases. Okay, so these are either spread by a bacteria or a virus. Okay, so this, when we talk about bioterrorism. So anthrax, botulism, Ebola. Do y'all know about Ebola? Okay, hemorrhagic. Lassa fever makes me think of like dengue fever, the plague, ricin, smallpox, and tularemia. I'm not sure about tularemia. Let me look that up real quick because I have no idea what that is.
What happened to Ebola?
Ebola is still out there. They actually still have outbreaks in Africa. I think it was like maybe 6 months ago I was reading that they had another outbreak. But not like before. Tularemia is known as rabbit fever. It is caused by the bacterium Francisella tulaneris. Okay, and it's found in animals, especially rodents, rabbits, and hares.
So what, that rodent got a bite or something?
Yeah, it's like rabies or something like that.
Typically, people become infected through the bite of infested insects, commonly ticks and deer flies, by handling infected, sick, or dead animals, or by eating, drinking contaminated food or water, by inhaling airborne bacteria. Okay, so stay away from those wild animals. Well, one time my husband found this rabbit and he's like, oh, and he caught it. And he's like, hey, I was like, no, I can have disease. What's wrong with you? Okay. All right, decontamination. decontamination. So, if you have military experience, I know, Hospitalidatis, you have experience with this, the decontamination. And in the Navy, you would have to strip down. If you were contaminated, you'd have to go into the chamber and you would have to strip down. It's just one of those things you hope never happen.
Huh?
So you have to take off everything because what you
And
have
do
on
what?
is
Stay in there?
you have to stay in the decontamination station. They're gonna spray you down with water and the decontamination agents. That's in a medical, in a military kind of setting. So we're talking about nerve agents, that kind of thing. So but in the hospital setting, you're not necessarily gonna do that, but, the concept is the same. The concept is the same. So we're wearing masks. So y'all know that with COVID, y'all seen them in those big suits.
Yeah.
So that's what we're talking about. If you're working with a patient that has something like that, and that was something really big when COVID started, they were wearing all of those suits to go in. And so it's like they would have a certain nurses assigned, so they wouldn't have to keep taking all of that equipment on and off. They would cluster their care, so they wouldn't have to keep taking all of that off. So that is called MOP gear, military mission oriented protective posture suits, and that's the suits that we talk about. If you see the movie Outbreak or one of those kind of movies, that's the full gear. When you see that, it's white suits. It could be like a sky blue suit or a yellow suit, but they've got the mask, the respirators. Like, you know that it's bad when they've got all that stuff on. Okay, so that respirator must be worn. And that respirator has a filter, and that filter is really important. It's usually activated charcoal because it helps, nothing can come in. Okay, so that's important. So if they got all that gear on and they don't have a filter on, it does them no good. They're just breathing in that air. All right, let's talk about the triage, the tagging, and we're almost at the end. So let me just do. So we're talking about the triage. Triage nursing is a little bit different from regular nursing. This is a kind of like a mass casualty scenario. This is if the amount of casualties is more overwhelming than the amount of staff and resources that we have. So if there is a tsunami, if there is an earthquake, if there is like a massive shooting, God forbid, right? We're going to be in triage mode because as nurses, we want to save everybody. But in a triage kind of scenario that's like a natural disaster or something that's really horrific, we have to save what we can save. A black tag. This is a patient that has minimal chance of survival. An example, I've seen like an NCLEX question, the patient was in a 20-car pileup or they were in an accident, the car is still on top of them, their skull is cracked, part of their brain is oozing out, and they're gasping. Okay, this patient is a black tag because even if I was Hercules and I lift the car off of them, their brain is oozing out to the ground. So they are a black tag. I know it sounds really tough and rough, but okay, I don't have any resources to work with that patient because I have to save my red tag people. Red tag people, they may survive if they get medical attention right away. This is the one that has to be medevac. This is your patient that may have a massive hemorrhage that we maybe put a tourniquet on. Maybe this patient has a tension pneumothorax, like a partial collapse of their lung. They could survive if we get them out of the area and to the hospital. Yellow tag, they have small injuries, right? But they don't need to be seen right away. The green tag are the walking wounded. They can a lot of times help the other people that are more serious off. So they have maybe some sprains, contusions, right, bruising, but they'll be okay. They can help take care of the others. Any questions on the triage? So you should know this, maybe not necessarily for your test, but this is something that you could see for NCLEX. So black tag, the patient, just get a body bag because that's where we're going with that. Red and then yellow and then green. Okay, so that is the triage system. So that's what we're talking about. Yes. Expectant is they're expected to die. Immediate is going to be red. Delayed is yellow, and green is minimal. Okay. Now, when we have certain biological agents, if it's a bacteria that causes this condition, we could expect to administer antibiotics. Sometimes, if it's like a poisonous gas or a nerve agent, we'll have to get the antidote. You can see that a lot, like in Hollywood. Okay, like there's one movie, Nicolas Cage is like, oh, I gotta jam an atropine needle in my heart or something because that's the antidote to whatever the nerve agent was. Okay, so depending on what the attack is, whatever that agent is, if it's a bacteria, if it's a virus, or if it's a nerve agent or it's a chemical agent of sort, that's going to depend on how we treat the patient. Okay, and we really want to watch for their organs still being able to function. Now, poisons. Okay, poison control is very helpful. Okay, they need to contact the poison control. So poison, it could be little Susie was crawling around and mommy and daddy had rat poison in the corner and they took a few bites of it, right? Immediately call poison control because they're going to tell you when you tell them what is the product, how much was ingested, it was, a small child that's 6 months old, right? Any symptoms, they're going to say, okay, you know what? Stay at home, drink milk, drink water, or no, you need to immediately go to the emergency room. Like poison control is really, really good for that. Okay. And so substances can be, it doesn't necessarily have to be like rat poison. It could be those Tide Pods that kids think are candy. It could be that a small child sees a bottle of pills, grandma's blood pressure medication, and they think that it's candy. So they take a bunch of it, right? So again, that goes with patient teaching, safety, that kind of thing. And then antidotes. I took my stuff away. I'm going to post a list of antidotes. You don't necessarily need to know antidotes for this class, but when you get to pharmacology, antidotes are going to be a big deal. As far as like, your heparin or certain other medications, you're going to need to know. Okay. Protective devices, those are restraints. So if you see protective devices, understand that they're talking about restraints. Okay. Um, and there are physical restraints and there are chemical restraints. Chemical restraints, what's an example? Well, I'm going to give my patient that Ativan cocktail. They're going to take a ride on the van. They're going to take Ativan and Benadryl. That's going to knock your patient out for the entire shift, right? And we can't do that. And I have seen that done, and I've seen memes on social media. Oh, my patient's going to take a ride on the van, the Ativan, right? And so,
I just had a question about that on that got these things called Reliance at Work, and I was reading it out loud, and the nurse and the unit manager said that was the answer. I said no. They said, "What do you give a patient, who have behavior issues, want to keep going outside with the alarm being on?" And they said, "Give them Ativan, that type of medicine. Take them outside for a short walk, bring them back, or just keep telling them no." They told me put the Ativan answer, and that was incorrect. And I said, I don't think you're supposed to do this.
no, you should take them for a short walk
Yep, that was
to
it.
get them tired. Okay, they want to get outside, take them for a walk, and then bring them back in, and they should be tired. Because that is actually a chemical restraint, and we cannot restrain our patients. Okay, we cannot restrain our patients. Now, is it done? Of course it's
That's
done.
why they said that.
Yeah,
That's
because,
why
but that's not NCLEX, okay? You're
I
gonna lose
was
your
like,
license, okay?
no.
So you gotta know your regulations, okay? That's not good, okay? So we can't abuse our patients, you all know that, okay? And we talked about the time frame and all of that, okay? And so it's very important. So less restrictive, right? So we want them to be to the least restrictive environment. Um, and so family and friends of a patient who's confused can be encouraged to sit with the patient to promote safety. However, that does not relieve us of the responsibility. Don't say, oh, well, the family's in there, they let him fall on the floor. How do you know that little Johnny and little Susie is waiting for grandma to fall so they can get grandma's inheritance, right? If grandma falls and busts her head, then she's going to die and then they get what's left in their will. So you can't assume that the family always has the best interest of the patient. And at the end of the day, the healthcare facility, the healthcare workers, we are responsible for the safety of the patient, okay? All right, so protective devices, we talked about that already. Big thing, the device must be removed every 2 hours, right? Every 2 hours, assess the skin, assess the patient, make sure that they still have a pulse, they still have good capillary refill, and we're gonna do those range of motion exercises to make sure that they have adequate blood flow. That's, yes.
Every 2 hours too.
Yes, absolutely. Yes, every 2 hours is the standard. If you see 3 hours, 4 hours, that's not the right answer. The use of the incentive spirometer to help their lungs, that is every hour during the time that they're awake. Okay. The use of the incentive spirometer, that's when they blow, they'll do it 10 times to help to get full expansion of their lungs to prevent pneumonia, atelectasis, right? Which is lung collapse. Atelectasis is lung collapse. But yes, turn them every 2 hours to immobilize patient because that's going to prevent pressure ulcers. Oh, you all know this. All right, most agencies use the RACE acronym to respond to a fire because it's easy to remember. Which letter is identified correctly? Run away, R, run away from immediate danger. A, activate. C, call 911. E, evacuate.
But she said which one
Is correct.
Oh, you said correct. I said incorrect. Say it again. I'm sorry. It's
It's E is extinguish, so that's not correct. C is confined. Say what? Say again.
So it's A.
It's two.
It's two. It's activate. Yes, and we're not gonna run away, right? You run away, but your patient in the wheelchair can't run away. What are you gonna do? You're gonna let Mrs. Smith burn up? You can't do that. Okay, don't do that. All right. Do y'all have any questions on this one? RACE, what it stands for? Run away from immediate danger. A, activate. C, call. E, evacuate. E is not evacuate, it's extinguish. C is confine. A is the alarm, activate the alarm, and A is, R is rescue. Okay, do not run away and leave your patients. Any questions? All right, so Melanie is working in the emergency room. Her patient is vomiting and has diarrhea, loss of appetite, skin damage, and potential for seizures, coma, or death. So the patient informs Melanie that she was exposed to a high dose of radiation in a short period. What does this sound like? Oh, I'm sorry, anthrax, botulism, acute radiation sickness, or radiation contamination. C, yes, acute radiation sickness. Even if you weren't sure, I know that there's no white powder involved. It's not botulism, radiation contamination because of the nausea, the vomiting, and it is a short, high dose of radiation in a short. Actually, no, I don't know if that's right. Let's look that up for a second.
In a short period.
In a short period, because it could be radiation contamination. I'm not sure. Let me look that up real quick. Yeah, so let me make sure, because I don't want y'all to say, well, she told us. Let's see, radiation, treatment, poison, protective devices. Fire, biotech. Okay, acute radiation sickness is on page 339. Develops when most or all of the body is exposed to a high dose of radiation, usually over a short period. So it is right. Okay, I just wanted to make sure. Okay, very good. So acute radiation sickness is in your textbook on page 339. All of the body exposed or most of it exposed to a high dose of radiation, usually over a short period of time. And that is acute radiation sickness. Last question. Darby is a nurse working in a long-term care facility. She needs to use a protective device on her patient to ensure safety. When applying protective devices, it is important to remember all of the following except this is a negative question, right? So try all alternative methods first. You should be able to easily fit your index and middle finger between the patient and the device. Secure the ties of a protective device to a movable part of the bed frame. At least every 2 hours, remove the device and provide passive range of motion exercises. So 3 is correct. We don't want to put it on a part of the bed that moves. Okay, we do want to try other things first. We want 2 fingers to be able to fit under the restraint, not 3, not 1, it's 2 fingers. Because if it's less than 2, it's going to be too tight. If it's going to be more than 2, it's going to be too loose. And then every 2 hours, I think y'all get that part. Okay, any questions? 3 was incorrect. We don't want to do that because this was a negative question. When applying protective devices, it is important to remember all of the following except. So that means we don't want to do that, okay? That's not going to be what we do. Okay, online, any questions?
No questions.
No questions.
No.
Okay, you all are dismissed
Yeah.
online. Okay, fantastic. Okay, in person, any questions?
Thank you.
You're welcome. Thank you. SDS is safety data sheets. That's a great question. Safety